Today more than ever, with the growing number of patients undergoing clear lens exchange, with premium IOL implantation to correct presbyopia, and the increasing visual expectations of patients undergoing cataract surgery, minimizing the amount of residual refractive error has become of paramount importance. Today, we would like to introduce Ebitoric, a novel system that Dr. Edmondo Borasio from Italy developed in 2019 to accurately mark the implantation axis. The system consists of an iOS application which captures a photo of the eye, taken after a dot has been applied in any position on the limbus using a marker pen, while the patient is sitting down. Once the photo has been taken, the app displays the offset between the dot on the limbus and the implantation axis. In this example, 36 degrees counterclockwise. This offset is recorded by the scrub nurse and will later be used to mark the implantation axis. We write down the offset on the trolley's drape using a marker pen in order not to forget it, but a screenshot is also saved automatically on the device, and this can be used later for statistical analysis. Since I find counting clockwise more natural, I always try to place the dot on the limbus to the left of the target implantation axis. A compensating mechanism based on the accurate internal gyroscope of the device ensures that the eye images acquired are always kept at level. During the operation, using the dot on the limbus as reference, in a toric gauge, the implantation axis is marked on the cornea using a standard axis marker. The easiest way to mark the implantation axis is by aligning the 0 degrees position on the toric gauge to the dot present on the limbus, and then counting clockwise or counterclockwise the degrees of offset required. Here you can see a sequence of some of the cases done so far. Here is a short video that summarizes all the steps required. It sounds complex, but it gets very intuitive after just a couple of operations. Step 1. With the patient sitting upright, using a marker pen, we apply a mark on the limbus in any position. Step 2. Using the EB TORIC app, we take a photo of the eye where the mark is well visible. Step 3. We zoom in and move the image until it is completely centered, and we press the red button to fix the image. Step 4. On the EB TORIC app, we align the blue marker with the dot on the limbus. Step 5. We then set the incision location axis. Step 6. As a last step, we set the toric IOL axis. Step 7. We press the mail button, and the image gets automatically saved into our photo album, and there is also the option to send it by email, if desired. Once we are in the operating room, we use the toric IOL axis offset shown on the application to identify and mark the implantation axis with a clock or an anti-clockwise rotation. Similarly, if desired, we could also set the incision axis using the offset provided by the application. This is optional, as it would not affect the final toric IOL alignment. However, it is always desirable placing the incision accurately on the same axis that was entered in the SIA calculation. An internal study performed on 95 eyes shows excellent reduction of the astigmatism using EB TORIC and shows the app being more accurate compared to manual techniques and similarly accurate compared to much more complex and expensive digital systems that are already on the market. Also, differently from these systems, no technician is required in the operating room, and no time is spent prior to the operation to perform any lengthy scans. In summary, Ebitoric makes the marking procedure extremely fast, literally just a few seconds, and prevents accidental corneal abrasions caused by eye movements. Ebitoric is now the only system I am using to mark the axis, and the results are excellent. The app is available on the Apple Store for those who wish to try it. Thanks for watching.